All right. Good morning, everyone. It is another fantastic Monday morning here at Health Plan Markets. Thank you guys for being on this call early. It is 9 o'clock on January 26th. And as we gather here today, a reminder that Health Plan Markets exist to serve those that serve others. So we are here to provide the service that you need as an agent and as an agency to deliver the highest quality service for your clients. So whatever that looks like for you, whether it's service, whether it's tech, lead generation, connections, whatever that case might be, we are here to help you level up your career as a health insurance agent. So thank you for that. Now, we are jumping over to HQ here. And as we normally start, I want to dive into the training here. And I'm going to share my screen. We're going to do this window here. All right, give me a thumbs up if you guys can see my screen okay. That's cool. Got some chat. Okay, got some thumbs up. Thanks, guys. All right, and good morning, everyone. Good morning, Angel, Chan. Good morning, Arlene, Mike, Nancy. Thank you, guys. Appreciate that. All right, so this is HQ 1.0. We have HQ 2.0 coming out very, very soon. But until then, continue to log into HQ as your dashboard. Essentially, what we want to do, as we normally do, is this is your headquarters. This is where you start your day, run your day, and end your day. If it doesn't live here, then we need to add it. That's essentially what we're building here at HPM. So HQ is here. And I want to show you guys again how to get to your training calendar. You're going to click learning and you're going to go down to the training calendar here. And this will show you what we've got going on for this week. Again, doesn't have everything, but it does have some highlights, especially for those folks that are in the Central Florida market. If you're in a different market, that's okay. Just make sure that you're checking your emails for local events. We do our best to compile, the national trainings here. To do every single market would be impossible. So just know that. So today at 10 o'clock, Humana is doing their Medicare supplement training. Many of you have asked for supplement training. It is here. It's at 10 o'clock today. UHC is doing low income subsidy and extra help. That's at 11 o'clock today. You've got to master this if you want to know how to sell year round and not worry about AEP anymore. Once you've mastered this, you can really, really make a difference in the community. Later today at 4 o'clock, Humana is doing their chronic special needs plan. This is the hottest part of Medicare right now, is the chronic special needs plans. You've got to master that as well in order to write year round, especially here in 2026. Tomorrow, the 27th, you've got Aetna doing a deep dive on CSNPs at 10 o'clock. At 11 o'clock, Aetna is teaching you how to do retail events and be ready for them. At noon tomorrow, UHC will be teaching you how to do member retention, followed by best practices during open enrollment. So that's a back-to-back training. And then at 2 o'clock, they're also doing CSNP training. So grab one of those. At 9:30 on Wednesday, our very own Al Clancy will be available for a virtual coffee and chat. You want to chat, not a chat. You want to think of him as your personal coach. What is it? Where are you right now? What is it that you need to know? Some of you don't know what you don't know. And so I think Al will help kind of drag that out of you. So he's available from 9:30 to 10:30 on standby. Take advantage because every good player needs a great coach. 1 o'clock on Wednesday, DSNP training by United Healthcare is being hosted. Moving over to Thursday. If you're not in the Orlando market, Aetna is doing member retention training at 10. If you are in Central Florida or nearby, we are doing our monthly advisor meeting. This is the first one for 2026. We haven't done these in 3 months. We usually shut these meetings down during OEP because everybody's busy running around. There's no reason to pull you out of the field. So this is our first one for the year for 2026. It will be in Altamont at the Hampton Inn at 10 a.m. this Thursday. So if you're in the Central Florida market, please RSVP. We will have food, and Dedicated will be our sponsor. And we're going to be on the call today talking with Sean about dedicated and the updates for 2026. Okay, so get down there if you're in Central Florida on Thursday at 10 o'clock. A monthly advisor meeting is a must. I guarantee you, you will leave with something in your brain that will make sense. Promise you. Okay. And then Friday the 30th, believe it or not, this is the last week of January. Can you believe it? So you want to button up any last sales. Tom Ryan will be going over selling tools. He'll be teaching you how to use HPM Shop. That's at 9:30 on Friday. And then UHC is doing Find and Engage Consumers at 11 o'clock on Friday. So that's the training for the week. Remember to keep one foot in the classroom and the other one in the field at all times. Good rule of thumb, as a reminder for training this year, I challenge you to do one of these classes or come to one of these training sessions once per week, just one. If you do that and you stay committed, then you will essentially attend 52 trainings in a year. Think of how much stronger and smarter you'll be if you do 52 different trainings throughout the year. Think about the power of that, guys. Really, really think about it. Remember, it is your job to know this stuff because you are out there helping people. Don't not know your stuff and hurt someone. This is important. So that's why we take training very, very seriously here at HPM. Wanted to remind you guys of that. Just a quick announcement. Well, let me go through HQ really quick. If you go down to commissions, we've got our AEP contest. That is still being updated. I want to let you know that this has not been finalized yet. So we are still tracking points from AEP from everything up until 1/1. So we're continuing to update this as we're continuing to go throughout. So Mike and John and Liam will be working on finalizing this for AEP. It might not be ready until next month as far as where you landed with points. So just know that we will have a finalized form on this coming soon. I know we're going to get questions, but again, if you had any questions about the AEP contest, just go down to commissions, AEP contest at the top, and you can scroll down. I made a video there. You guys can watch that. The point tiers and the rewards are here. The contest overview and rules are here as well. And then how you earn points is cleanly listed here. If you did an app off of HPM Shop, as long as it was not available, either the carrier or that particular plan was not available, go ahead and submit that application here. So if you need any help with that, if you're not sure if you submitted apps or not, you can send an email to support@askhpm.com and we're happy to help you with that. We are going to St. Lucia on May 29th through June 3rd. May 29th through June 3rd is our trip. That's our destination. It is a stunning Caribbean island nation featuring volcanic spires, pristine beaches, and a world-class resort that we're going to be staying at, all inclusive. It's a short flight from Florida. So we would love to have you on there. If you didn't quite make it, you are still welcome to join us. So we will have a group discount available. Just shoot an email to support@askhpm.com and we will get you the information you need to join us in St. Lucia, May 29th through June 30th. All right. Thank you guys for that. And then just quickly, I do want to talk about some emails we've been seeing from agents that have been either very slow to respond or non-responsive to carrier communications, especially when it comes to secure emails. This is a compliance risk for you. Pay attention, please. If you are not responding to your emails from a carrier on a compliance issue, then you will automatically be red flagged and you most likely will be suspended until you answer. If you do not reply at all, you may be terminated, including your residuals and commissions. Gone. So it is imperative that if you receive an email from a carrier, please respond. If you need any help with an email from compliance at Health Plan Markets, we are here to help you. If there's a boo-boo that came up, If somebody's saying that you tricked them or whatever the case might be, you need help, you can email us at compliance@askhpm.com. I'm putting that in the chat as well. compliance@askhpm.com. You can forward that email over, and we'll jump on a call to guide you through on what you need to do. We will be making outbound calls if we're CC'd on it. Sometimes the carriers do not CC us on things. That's why we're asking you guys to please pay attention to your emails. And if you need help, we are here to help you respond to those carrier communications. So we don't want to have any boo-boos. If we're aware of it, we will reach out to you. Just please make sure that you respond in a timely manner. If you don't, it looks a lot worse than it could have been. Okay. I want to relaunch. This is a relaunch program. And then John and Mike, if you guys could just take a quick note, we need to add this into HQ somewhere. We have a referral program here for referring an agent to health plan markets. So if you bump into an agent that needs to be saved, that needs to, oops, might be a little bit too big, that needs our help, this is it, okay? So if you tell a friend about HPM, we will give you $300 once they join, okay? So the way it works, we call it the 333 because it's easy to remember. You refer an agent and they come on board, they contract with 3 carriers, they do 3 sales. Within 3 months, we will give you $300, okay? So again, you refer an agent, you save an agent, they're out there, they're struggling, you save them, you say, hey, why don't you come work with us at HPM? They come on board, they contract with 3 carriers, they do 3 sales within 3 months, and we are going to give you $300, okay? Easy to remember, it is there. So if you're going to these meetings, if you bump into somebody that's at another agency or they're just lost or maybe they're new, we've got a referral program for you, okay? So that is what it is. And we have a link here. So if you do bump into somebody and you would like to go ahead and schedule a call with Ron. Ron is going to run this effort. This is Ron's link here, and this is what the form looks like. You're going to put in the agent's name, phone number, and email, and just make sure that Ron is aware that you are referring that agent, or make sure that the agent knows that you're referring them in, okay? If you don't have Ron's info, just shoot an email to support@askhpm.com. Hey, I referred an agent, Joe Schmo. For now, we're going to fix this form so that way you can put in your name, and then, you know, it's automatic. So we will put that on the to-do list as far as getting this form cleaned up and ready to go. So if you are out and about and you bump into an agent that needs our help, we want to reward you for spreading the good news. Again, they come on board, they contract with 3 carriers, they do 3 sales within 3 months, and we will pay you $300. Okay, so really appreciate it. You don't have to do anything. Just talk to them about how great we are. Get them on a 15-minute call with Ron to interview, to make sure that they're a good fit and we're a good fit for them, and we'll get it going. Agency owners, this does not apply to you, obviously, because they're going to go on your team, okay? But if you do have an agency that is available, we will talk to you about that referral process as well. So if there's an agency that has agents that really needs our help, we can definitely work with that as well. Mary, if you have a new agent that needs onboarding, go ahead and reach out to your normal contact, either Sam or Jessica, and they can help you begin onboarding. We're going to have a new process for onboarding soon, coming soon, where you just simply fill out the information and then the agent gets the stuff. So that's coming soon, very, very soon on HQ 2.0. Okay. With that, I did want to talk about the legacy program, but I don't have time today because we should have a special guest on the line here. I am looking for Mr. Sean Thorne. There he is. Boom. So I'm going to make him a presenter. And if you have not yet had the pleasure of meeting Mr. Sean Thorne, he is quickly becoming a legend in this business. Sean, you might need to test your mic, so just, you know, shout once you get connected here. And he is at Dedicated Senior Medical Centers. also known as ChenMed. That is the parent company. And he's going to give you the latest and greatest on what's going on with Dedicated. So, Sean, can you hear us okay? Might have a tech issue. Oh, wait, I see him coming on board. I see you. You're looking good. He's working on his mic, I think. No, not yet.
Oh, now, can you hear me?
Oh, we got you now, brother. We got you now. All right. So the brilliant Sean Thorne, take it away, brother.
Awesome. Hey, thanks for giving me some time this morning. Always a pleasure to be on with this group. Love working with HPM. You guys have been valuable partners for many years now. So really do appreciate the partnership. For those of you who don't know me, my name is Sean Thorne. I'm the Regional Sales Director for Dedicated Senior Medical Centers. My territory consists of the region we call Florida West Central. That's our Orlando markets, Lakeland, Hillsborough, Pinellas, all the way down to Manatee County. So if you're placing any business within that area, feel free to reach out to myself or team, because we're looking to grow in 2026. As I reflect on 2025, for us as an organization, that really was a year of stability, and kind of honing in some of our practices when it comes to ensuring that we were taking in line things that were happening with V28 and the way that the Medicare landscape was changing. But as we enter into 2026, really what we're looking at is growth throughout all of our centers. We're looking to continue the partnerships that we have and really gain new ones. So if you're new to the industry, you just came out of your first AEP, things of that nature, you're going into your first OEP, definitely give us a try as far as an MSO that you would like to partner with. Some of the highest producers that we have placing patients in our centers come from HPM. I'm happy to say that we've had some really good partnerships from not only individual agents but agency owners who have entrusted us along the way with placing their patients and helping to retain their book of business. I'm going to briefly share my presentation. Let me make sure I can do that here.
Yeah, there's like a little box with an arrow.
Yeah, I'm looking for.
While you're looking for that, I also want to brag on the fact that you are a diamond sponsor for Health Plan Markets. So you guys will see a lot of Sean and his team throughout the year at our special events. So I personally want to thank you for that partnership as well, because guys, without partners like Dedicated, we can't do some of the events that we do on a regular basis, including our Thursday meeting that we have monthly. So when you see Sean, please make sure to personally thank him for supporting the efforts that we do as an organization. So yeah, man, take it away. We got you. Looks good.
Awesome. So once again, Sean Thorne, Regional Sales Director, that's my contact information. Feel free to jot that down if you ever need to get in touch. From time to time, I know agents will reach out to me in regards to situations or things that they need help with. So more than happy to be a resource for you and help connect you to the Orlando, Tampa, or Lakeland teams if need be. So we are dedicated. We're transforming healthcare with a unique approach to primary care. For those of you who are familiar, we are in the value-based care business, which means we take on full ownership of patients once they're assigned to us. The biggest compliment I always get is when I run into agents and brokers on the street and they tell me that they send their parents or grandparents to our centers, because if you're entrusting us to take care of your loved ones, then we're doing something right. We honor Medicare eligible seniors by providing affordable VIP care that detects and prevents high risk diseases and simplifies complex care. We're located all over the map, especially on the eastern side of the country. We've got offices in Miami, we've got offices in Atlanta, Chicago, Kentucky, Louisiana, Virginia, Ohio, but most importantly, we're here in the West Central Florida region, which, like I mentioned before, consists of that area all the way from Orlando west to Manatee County. So if you're placing patients anywhere on that board, please don't hesitate to reach out to us. We deliver an approach that consistently delivers better outcomes. 35% fewer emergency room visits, 51% fewer hospitalizations, and 80% fewer patients than the typical primary care provider. So, what that means is, when you're entrusting your patients with us, you can almost be guaranteed that they're going to be put in a better circumstance when it comes to their health care. What we do strongly is try to implement behavioral change. So when you're coming across patients that may not have been used to seeing a primary care provider and utilizing the hospital system, the first thing we try to do is embody that trust with them, get them to trust us enough to come to their visits on a frequent basis, really get to know our care teams within the center, as well as their primary care physicians. And that's the reason why we keep our physician panels very low, because we want to give them time to be able to meet with each individual patient at least on a monthly basis. Our model is different. We prioritize the whole person care. We invest in our patients starting from day one. Regardless of what medical records say, we run our own complete health assessment and screenings to develop a comprehensive personalized care plan. We make care convenient. We offer 24/7 access to care and conduct laboratory services and screenings, and dispense more than 400 plus medications conveniently on site. We have a variety of additional services that we offer in our centers, to include urgent cares on the weekends. We're bringing actually specialties in-house, whether that's cardiology, neurology. Coming soon this year, we're also going to be offering pain management within our centers. So trying to keep a lot of that in-house so that we have cohesive care between physicians and specialists. We focus on primary prevention. We see patients as often as necessary to optimize their health, typically once per month. We offer same-day appointments, walk-in and virtual care visits. On top of those frequent visits, if you've ever been in our centers on a day where we're doing events, we have a number of different things that we offer in order to not only help a patient health-wise, but also socially when it comes to different events, whether it's bingo, movie days, things of that nature. You'll see line dancing in our centers, all kinds of things going on to keep your patients engaged. We simplify complex care. We collaborate with a vast network of trusted specialists and hospitals to coordinate complex and specialty care when needed. I just want to reiterate that 450 patient maximum panel for our PCPs. I've been in your shoes as far as on the other side, referring patients as an agent and a broker. And sometimes when I referred a patient, I knew that patient may not be seen for 3 or 4 months because physician panels were through the roof, right? That's why we keep them low with dedicated. Prioritizing whole person care starts with a total health visit. The total health visit is a series of tests and screenings that designed to give us a complete view of a patient's health. It's administered before the patient's first official visit with their provider. The reason that we do that is because that gives the provider a comprehensive way to look at a patient's health alongside their medical records. It's conducted on site by our care teams, and it allows our providers to use the first visit to get to really know the patient, review their results, and develop a personalized care plan tailored to the patient's unique needs. A lot of times we get patients that come to see us, and they may have a laundry list of medications or specialists that they're currently seeing. And the reason being is because previously their care wasn't coordinated, right? A lot of times when patients get sent to a specialist group, they're working in conjunction with other specialists, and they're referring to specialists that may not necessarily be in the best benefit of the patient. We take that with a grain of salt when we receive it on medical records, and ensure that the patient is getting the health care that they actually need to be able to prevent them from deteriorating physically or health-wise. We have a patient questionnaire, 9 simple questions about sleep patterns, diet, and the patient's overall feelings on their health. We have health screenings, echo, EKG, labs, A1C or blood work, COPD, the PHQ-9, mood test, and BBS or skin health test. Medical records review, it's comprehensive review of available medical records that we're able to obtain. Some of the services offered on site to make getting the right care more convenient: primary care providers, cardiology, acupuncture, nursing, podiatry, social workers. Those are things that we have in place today. But like I mentioned, we're actually this year, we have a program that we're calling co-location, in which we're bringing specialists in-house that we don't normally have. So that list is actually expanding to include neurologists, pain management, and other things that we're going to try to bring in by year's end. Medication services are available, labs and testing, x-rays, transportation, coordination to appointments. I think this one is key, especially in an environment where we're seeing Medicare Advantage plans start to limit transportation. We provide transportation for every patient to come in and see us, even if that means if it's a same-day appointment or they're needing to see us on an urgent basis. Kelly, I was just looking to see, I see your message in the chat. Yes, yeah. All of our clinics do labs in-house. What we offer your business, our outreach specialists, or what we call membership growth consultants, they guide internally to help set up the appointments and offer quality customer service to your clients, loyalty and respect for your clients and you. We never initiate changes to an existing Medicare Advantage plan and always refer benefit questions to you. One of the things I'm most proud of as far as leading this region is the hard work we've done as far as implementing a CRM that really notates who the agent on record is to make sure that all business is going back to you. Any questions that are asked by patient when in our centers, we refer back to the agent on record. The key thing there, though, is that in order for you to be agent on record within our systems, you have to be doing business with one of our membership growth consultants. So we can go ahead and make sure that's noted appropriately. Various steps to protect your agent of record. We track through our Salesforce CRM, staff trained on importance of agent on record. I think that was really implemented a lot in the last couple of years or so. We go through the AEP period really focusing on retention and the book of business for all of our agents on record. So let's build a strong partnership and grow together. What we like to do is introduce and connect to community contacts to engage in the neighborhoods that we serve. The beautiful thing about the majority of our outreach specialists is that they have tenure in their positions, which means that they've been out in the community, they've developed relationships, they've got community partnerships that you may not already have. And if you're partnering with them, they can get you into places that you might not normally be able to get yourself into. Co-host educational events on site at our centers and in our local communities, such as Medicare 101s, LIS, T65 seminars. You know, a number of you have done seminars with us, which we've either sponsored, co-sponsored, and we've had really good turnouts, right? Either in our centers or at restaurants and things of that nature. Gives you a great way to get in front of a large group of, Medicare eligible seniors, and really partner with us to get them engaged in the right places. Access to marketing resources to promote your services, and co-branding and marketing sponsorship opportunities. We've got unmatched patient satisfaction. 96% of our patients were able to get an appointment to see their physician right away. 92% of our patients are satisfied with the amount of time that they're spending with their physicians. 96% of our patients feel our staff treats them with courtesy and respect. And 95% of our patients say their doctor listens carefully to them. With that, I know I'm slightly over on time.
Great.
So I'm going to hand it back over to you, Justin. I do see one other question as far as what carriers do we accept. We actually accept the majority of them. All your major players, your Humana, Care Plus, Aetna, Health Springs, WellCare, Cigna, and all of Elevance, whether it's Devoted, Simply, Optimum, and Freedom. And we also accept Devoted.
Awesome, man. Awesome. Like, again, like solid as far as physicians are concerned. I just posted a poll that I did while you were speaking. We had about 56 people on this call. 29 of them voted. So we had about 53 agents vote right now. And luckily, because I was nervous at first because we had a lot of no's coming in, but I asked them a question. I said, are you currently working with doctors to grow and protect your business? And we had 17 people say yes. So that's good on you. We also have 12 agents that are not currently working with doctors. So I want to say something about that right now. If you're not working with doctors, you are missing a massive opportunity to grow, but more importantly, partnering with a physician that will protect your book of business. Sean kind of went through a lot today, but like the fact that they're watching and protecting books, those are the type of partners you need to work with, because the number one thing you should be bringing to a physician is, hey, I'm going to bring my clients and I need to know that you're going to be there with sword and shield to ensure that my members are not going to get flipped, because that's number one in the partnership. From an agent's perspective, that's what you should be thinking about. But I want you to talk about this, Sean, because we got 12 people on this call that are not working with doctors. But one thing that you may not know about Sean is he is also a recovering insurance agent like me. So, can you talk about why an agent needs to work with a doctor? And if they haven't started yet, like these folks here that said no, what's the first thing that they should be doing, knowing like you got a partner like dedicated in the field, ready to go help you bird dog leads, but again, going back to that protection and that partnership. So I know it's a loaded question, but Sean, why don't you talk about like your experience as an agent, and then why? Because he's not just telling you from the physician's point of view, guys. This is an agent that has worked in the field, that has done Medicare Advantage sales, and has worked at physicians' offices like I did as well. So, Sean, I'll leave it to you.
Yeah. That's a great question, Justin. I think the best way for me to answer it is by telling you a little bit about my personal story, right? So I was an agent and a broker at certain times in my life. When I turned agent or captive agent with WellCare, this was many moons ago. I started off by just doing the hustle. I did retail events. I did a lot of cold calling. But it wasn't until I started working directly with physicians groups that my business truly took off. I went from being an average producer to being the #1 producer in the Orlando area.
Wow.
So much so that this was around the time that the dedicated offices were really just getting entrenched. They had built 3 offices in Orlando and were popping up 2 more within a 2-year time span. And I got so entrenched in these offices, not only the dedicated ones, but other physicians groups as well, that I would do presentations in their offices. I would do meet and greets and all kinds of things to help support and grow their businesses. I'll tell you, as an agent, the first year that dedicated senior medical centers came to Orlando, I placed over 200 patients with them in coordination with them. And that was from joint events, that was from working with their outreach specialists and doing a lot of things within their medical centers. So much so that they approached me and said, "Hey, if you're doing this well for us on the outside, we'd love to come join us on the inside." And I later became a director and started running one of their newer medical centers. Now, I'm not saying that that's the path for any of you, but the volume that increased in my business due to the relationships and me working directly with physicians group is something that we should all try to achieve, right? And shoot for, because those partnerships are invaluable, not only from the aspect of you being able to market, but also to have a connection so that, you know, when your patients are going to specific medical centers, that you have that relationship to be able to help them and know what it is that they're getting involved with.
Boom. We had a couple other questions on the other side, on the Q&A side. This one's from Al Cerna. If you know Al, I mean, you got to know Al if you're in the Polk County area, but has the company improved on tracking AOR? That was his biggest concern. Outside of that, the care has been good overall in our market. Thanks for the partnership.
Absolutely. And I think that goes back to what I stated earlier, Al. I've taken great pride in being able to come in and really have an emphasis and a focus on agent on record. Coming from the world of insurance agents, you know, one of the main pain points that I kept hearing as I came on board as the market manager for Orlando, and even later as the regional sales director, is that we were dropping the ball when it came to agent on record. So it has been a huge emphasis of ours over the last 2 years to improve that insight as to agent on record. You know, there are no discussions that are had with patients at this time that where we're not focusing and looking at agent on record first. The issues that I tend to have these days when it comes to agent on record is that we were never notified who the agent on record should have been, because we can't get it from payer files or anything of that nature. We have to get it directly from the insurance agent, and the easiest way for us to get that is by you partnering with one of our outreach specialists to ensure that every time you all do business together, either they're referring a patient to you or you're referring a patient to us, that you're the one that is attached to as that agent on record.
Boom. So remember, if you're not working with an MGC, then you can go ahead and reach out to Sean. His contact information is in the chat. I put it in there for you guys, and then he'll connect you with the closest MGC in your market. So, and then could you remind everybody what MGC stands for? Because that's a very dedicated acronym.
It is. So our MGCs are our membership growth consultants. So, you know, their whole responsibility is to go out into the communities and grow our membership throughout our centers. I call them our outreach specialists as well. But, you know, I know, you know, Al, for you, there are 9 of them in Polk County. Here in Orlando, there are 12, and I believe they're now 16, and we're growing that team in Hillsborough. I think we have 12, and that team's growing to 15 this year. We currently have 24 in Pinellas and Manatee County, and that's going up to 26. So we are putting where you may see some of our competitors doing away with their sales teams and some of that outreach. We're putting a higher emphasis on outreach and really honing down on getting into the community and growing our panels.
Brilliant. Another question here is, how many dedicated offices are in Orlando now?
Currently have 5 offices in Orlando. They stem from West Orlando, so that's the Pine Hills area over in Hiawassee. We also have one off of Orange Blossom Trail. We're right dead smack in the middle there in Fairview Shores around the Maitland Lee Road area. We've also got centers on the east side of town in Winter Park, as well as off of Goldenrod.
Now we got somebody in Texas here that is asking for some more dedicated offices. So Align, I think, asking, Texas is so huge, we need them in every city. So I don't know exactly where in Texas Align is asking for here. But I know you guys do have offices in Texas. Which markets are you guys currently in now?
In Texas, that's a good question. I believe we are currently in Houston.
Oh, okay.
We were in Dallas, but I know we got out of that area. But it may be one that we revisit. I just I don't have any visibility on the Texas market at this time.
Yeah, that's not your territory, but yeah, I mean, we can definitely connect you with folks in Texas. So again, just email Sean and he'll linchpin for you somebody in Texas if you want to get moving in any market. Because I know some of you are doing multiple markets. We have folks on this call that are living in different markets too. But yeah, we can definitely connect you with whoever in any market. If you need a crash course on how to work with doctors, reach out to us, please. We're happy to help you with that. We're going to have some resources. And I also want to invite Sean onto our podcast that we've been hosting. So, we'll talk more on that, but I would love to have you on and talk about like why agents need to be working with doctors, long form, and maybe even a little bit of training and secret tips and tricks that, both you and I can kind of like, share, swap between each other, like our war stories and scars and all that too. So
absolutely. No, would love that, Justin. Would love that, Justin. And back to the earlier question. Yes, definitely hit me up in regards to getting connected with the Texas market or any market that we're in. I've got strong relationships with all of the regional and the market managers out in those areas.
Fantastic. I'm going to repost your info here just so it's at the top of everyone's chat here. Sean Thorne, extraordinaire, ex-agent, but still marketing genius. Thank you for being on the call.
Love it. I love it.
Really.
Thanks, Justin. I appreciate it. It's been a pleasure to join you guys this morning. I got a hard stop for the 9:45, but
you're good.
Feel free. Please reach out to me, guys. I'm more than happy to be a partner in your success in 2026. We did some tremendous work in 2025, and I'm looking for us to multiply that by twofold in 2026.
Beautiful.
Take care, guys.
Thanks for your time, man. Appreciate you. All right, guys. That is it for today's call. If you do need assistance, I'm seeing some stuff pop in. New agent, can you do a class on how to work with doctors? Yeah, that's what we were just talking about. We are going to do that. We do have some resources, Agnes, on some doctor training. It's a little old, but we're going to be chopping up a new one. So if you need access to those trainings, some of them are living in HQ under HPM University. So you can go there under training. If you're not seeing them there, please reach out to support@askhpm.com. We'll get you hooked up with some of those resources. And absolutely, we will be doing some more doctor training. So Nick, take note, because we're going to need to do some resources on that. You and I think would be great to tag team that. In the meantime, continue to be on these calls. We're going to continue to have great guests. If you are interested in working with Dedicated, you can reach directly out to Sean. or just reach out to us and we'll connect you with whoever's in your market. And again, support@askhpm.com is the easiest way to do that. We are monitoring those emails and chats on a daily basis, and that is what we do. All right, guys, that's it for this week. We will see you bright and early next Monday. It will be February by the time I get to you next time. So please make sure that you close out January strong, get those last minute applications going for 2/1 effectives. And if there's anything we can do to help, please reach out to us, 844-696-3975. Thanks, guys. Have a awesome, productive week. Good luck out there.